Hey everyone, happy Friday and welcome to the Henry Schein Dental Academy webinar series. My name is Adam, marketing specialist, and I'll be your moderator. We are excited to welcome Cindy Bickers and Heather Brown as our speakers today, as they will discuss the benefits of hiring and adding an associate to your practice. Cindy and Heather are managers with Henry Schein at Nationwide Dental Opportunities. Before we get started, we've got a few reminders for you. At any point during today's webinar, we do encourage your participation through the Q&A feature. Please type any questions you might have into the Q&A section of your control panel, and we will email you with an answer to your question. Henry Schein is not offering CE credit for viewing or attending this presentation, live or on demand. And this webinar is sponsored by Henry Schein Dental Business Institute, as well as Henry Schein Nationwide Dental Opportunities. Cindy and Heather, thank you both for joining us today. I'll throw it over to you.
Thank you, Adam. Before we begin the webinar presentation, I want you to know that the HSNDO family hopes that you and your family stay well during this difficult time. As a dental recruiter for more than 20 years, I know for a practice owner, hiring an associate dentist is a difficult decision to make. And if you're considering the possibility, you want to do your homework before taking that leap of faith. I'm going to share some information with you that will hopefully help you make that decision. We have two main topics for our webinar today: prepare to hire an associate, or tips to prepare for a successful partnership or transition. There could be many good reasons to add an associate to your practice. Do you have too many patients for you to treat? Are you booked out 3 weeks or more? I talk with dentists that are booked out for months, and if there's no room in your schedule for an emergency, there's a good chance you could lose a patient. As a dentist owner, do you want to cut back on doing dentistry to spend more time managing the practice, or more time to do the type of dentistry you enjoy, or you just want to have more free time? If you're a senior dentist, are you planning to transition ownership of your practice in the future? More than one provider may increase revenue in the practice while treating more patients. Another dentist can provide more hygiene checks as well to bring in new patients to the practice. More than one provider may also increase the value of the practice. With a partnership or a deferred sale, the associate is paying money toward ownership over time. So you as the practice owner may realize the profits of the sale of the practice today as opposed to sometime in the distant future. A deferred sale is easier for the associate to become an owner in the practice as well, so it can benefit both of you. More than profit, there are other great benefits of adding an associate to the practice. Now you have coverage for sick days, vacations, and emergencies, and the practice succession may be assured if something unexpected happens with the primary provider for the practice. So here's another reason for the benefits of an associate. Though there can be additional revenue from bringing the associate into the practice, you must have an additional patient base or you will be sharing your generated revenue. Because of the COVID-19, some of the practice owners I talk with are not as interested in adding revenue to the practice as they are in reducing the number of clinical hours they spend in the practice. If this is your goal, you may not be as concerned with the numbers. But here's some information on the profitability of an associate in your practice. You have an average production for an associate. You have the numbers right here. I've listed it as $400,000 per year, and I base that on 200 days per year, 4 days a week at 50 weeks at $2,000 a day. The additional expenses for that are the dental supplies at 6% or $24,000, office supplies at 2% or $8,000, laboratory costs at 8% or $32,000, the total assistant costs at $40,000, and then miscellaneous expenses 1% or $4,000. So the total expenses for that associate to work in the practice are $108,000. Now you have this associate compensation, and the average for that is around 35%. So you're looking at another $140,000 for that. And then, of course, there's Social Security and Medicare tax, which is $10,710. Total cost overall for that associate to be in your practice at that rate is $150,710. So the net profit to you for them being there is over $141,000, or about 35%. Now, this information is based on gross collections. It's not based on production. It's what they bring into the practice, for you. But as you can see here, there's a good reason for you to want to mentor your new associate as well. Because if you look at the numbers, this is an example of what they can bring into the practice. If you would add 3 or 4 associates to your practice, you would increase that, obviously, that number by 3 or 4 times. Of course, any change in these numbers, like the production, benefits, costs, anything's going to make this different, but this is just an overview of what you might be able to expect. Here are some things to think about as you consider hiring. What experience level should you require? Is a new graduate acceptable, or do you need someone with experience? What procedures does the associate need to perform based on your patients? Is your practice more focused on a specific type of dentistry, like is it highly cosmetic, crown and bridge, pediatric, whatever? This will also impact your decision about experience required. Are there additional procedures that an associate could perform, possibly something that you prefer not to do? Procedures that would aid in the growth of the practice by keeping dentistry in-house. It's important to prepare mentally as well as physically for a new associate to join your practice. Adjustments will need to be made. And I know it can be difficult for some dentists who have worked and built a practice over many years to offer a young new dentist the opportunity to reap the benefits of their hard work and dedication. I work with practice owners who feel that the new associate should pay their dues. Sometimes the owner wants to compensate the associate less than they should, or hold back on sharing any good patients with the associate. This isn't going to work out well for either of you. You want to be sure your practice is well established. Will it support an additional dentist? The practice should gross $800,000 per year or more. With the dental business changing, many practice owners are adding offices and locations to their existing practice. And purchasing an office doesn't necessarily equate to an opportunity. You must have a patient base there to follow. What is the active patient count? There should be a minimum of 1,500 active patients, and that's based on patients seen in the past 12 to 18 months, not patient charts. And you should be adding 20 to 25 or more new patients per month. If the patient count is too low, has a marketing plan been implemented to bring in new patients? If you expect a new associate to come into the practice to build their own patient base, this will take time. So the associate may need to make some income while they're trying to build a practice or trying to build a patient base. Most new associates do not want to build a practice within your practice. An associate will need to have about 800 patients of their own for them to earn a living. The patients they are given to treat can directly affect their income if they're paid based on their production. Now, reactivating patients can be a great avenue to introduce a new associate. So if you haven't had patients coming in on recall like they should, that could be a great way for them to come in and meet the new associate and get him or her started. At this time, some patients have not returned to the practice due to the COVID concern. So you want to be sure your fees are the best they can be. This may not only help your business, but it may help the associate's earnings. You want to maximize your revenue. So fee balancing is a semi-scientific way of making sure your fees are at the maximum. To be sure the fees are in line with other practices, you can get information from companies that do fee balancing to help you. Do you have the staff to support another dentist? How many hygienists does your practice currently have? Is it expected that the associate will perform hygiene? With the shortage of hygienists in some areas of the country right now, this may be a good option. You can start the associate out by doing some hygiene, and then this can help them get acquainted with your patients. And then they can perform any dentistry that might come from that exam. How many dental assistants does your practice have? Will a dental assistant be provided to the associate? Will you assign one of the experienced dental assistants to the new associate, or are you planning to hire someone? It's really best to put an experienced dental assistant with a new associate if possible. This is going to help them learn about your practice, your policies, your procedures, and also the dental assistant can observe the new associate to make sure that they're treating your patients the way that you'd like them to be treated. Will the associate be sharing operatories with other dentists? And how will they share space? Are they splitting schedules, like days and hours, so that they alternate? How many treatment rooms will the associate have to work from? For a new dentist starting out, the first 6 months, one treatment room may be okay, but after about 6 months, a dentist's production will be limited to 40 or 50% of what they could produce with 2 chairs in the same amount of time. So you see, it's important that you have enough space to bring that person into the practice. Once you make the decision to hire an associate, here's a list of some resources to help you find an associate for your practice. You have the dental school career offices. You have the State Dental Association. You have the dental job boards. You have trade publication ads, word of mouth, obviously, and then dental recruiters, such as HSNDO. What are the associate's expectations? And what are your expectations? And do your goals align? What are your expectations of this associate? More importantly, you need to know what they are looking for and understand the associate's expectations and the plans for their future. That's going to make a big difference on your relationship with the associate. If the associate is planning on taking this position as an interim position because they're looking to relocate to another part of the country, then they're probably not going to be there long term. That's something that you want to know. Set a schedule for the associate and try to stick with it. It can be stressful for an associate to add hours to or reduce hours from their schedule as planned. They may not like this kind of surprise. If you have more than one office or more than one location, you want to be clear about where the associate will be working, which offices. Will they be traveling between locations, or will they have one primary location? And please understand that adding hours to the schedule for an associate may not automatically bring in new patients. It could just be sitting. Obviously, all elements of an employment agreement are important, but compensation is one of the main concerns for all associates. Compensation is going to be the determining factor when there is more than one good opportunity to consider. For the practice owner recruiting an associate, you must be more competitive with your offer. What is the compensation structure? Will the associate be paid a draw or a guaranteed salary? A typical guarantee right now for a general dentist is somewhere between $100,000 and $150,000 per year. For a specialist, it's $120,000 to $175,000 per year. Will they be paid a percentage of collections or collectible production or production? This can be confusing to an associate, so be clear when you're explaining all this. The average range of compensation right now for a percentage is 30 to 35% of the associate's collectible production or collections. And will they be given production reports monthly or quarterly or how often? Normally, a percentage of collections is paid at a little higher rate than the percentage of collectible production or straight production. And is the practice involved in managed care? Will that impact the associate's earnings? All of this is important. What deductions will come from their compensation? Who pays the lab fees? Are lab fees deducted from the associate's gross collections or production, or are the lab fees deducted from the associate's net collections or production? The difference impacts the net earnings for the associate and also the earnings for you as well. Does the associate's position offer any benefits? With the cost of health insurance and student loan debt, benefits are more important now than ever. Many of the corporate dental practices offer benefits. There's paid time off, health insurance, relocation, student loan repayment, CE courses, and others. If health insurance is offered to the associate, who pays? Or is it a portion paid, all of it paid? What's the structure? Is paid for vacation or time off, how much? And if they're paid an hourly or daily rate, it's fairly simple to determine if they're paid for time off, if they're paid just strictly an hourly rate or daily rate. Sometimes it's more complex if they're paid a straight commission to come up with a percentage or a daily rate form if they take time off. Most times you want to pay them just based on an hourly or daily rate. That's the easiest way to do it. Are you going to reimburse them for relocation or give them some allowance for that? And then also the continuing education course reimbursement, which a lot of practices do that for the courses that they approve. What are the non-compete, non-solicitation restrictions? A dentist doesn't want to bring an associate into the practice to work for a year or two and then let them walk across the street and take their patient. Nobody wants to do that. So you should consider a no-compete. Ideally, it should not be effective during the first 6 months of employment. During that time, there's chances are that the patients will not or may not follow your associate if they leave the practice. It should be reasonable in distance and or duration. The distance is usually based on the drawing area of the practice, and the duration is typically 1 to 2 years after the associate leaves the practice. There's some form of a no-compete that's legal and required by employees in almost every state in the U.S. Of course, anything can be written in an agreement, but it may not be held up in a court of law. In some states where the no-compete is not enforced, the no-compete is written backwards as business assistance. So in return for the practice owner's assistance over the first 2 years, the associate will pay them a fee for that training. It could equate to 50% of the gross receipts of the practice. And the only way for an associate to pay for business assistance is out of pocket. They can't get a loan or financing for something like that. You don't want to make a damages clause excessive, though. I've heard of $1 million plus damage clauses in some of these agreements. Most candidates are not going to sign that. They're not going to agree to that, and you could lose a good associate because of it. The associate dentist will become an important part of the practice and your team. It seems that most people enter into a relationship only considering their wants or needs. Of course, it's important that you must consider the other person for a relationship to really work. And we've all heard this, but I know it's easier said than done. How you begin your relationship can set the tone for your future relationship. So be sure to start it with a fair and honest mindset. It's much easier to begin at a good point than it is to try to fix a damaged relationship later. And sometimes it's almost impossible to do. So there are two main priorities in most associates looking. They're looking in a desired location or at least a general area. So it's location's number one. But others are looking for the best opportunity within several areas. It just depends on what's important to them. Income's number two. They clearly want to meet their financial needs. It's more important than ever. With, again, like you said, the student loan debt at an all-time high. The average student loan debt, $300,000 or whatever. They really need to make sure they're going to have a good income. And if the associate accepts the position purely due to compensation or income or location, they still may not stay. So be sure you are compatible as well for personalities. You may have someone that wants to come into the practice just to gain experience or knowledge or some additional training. Or the employer is looking for someone to come in and cover hours and days or add hours or days to the practice. Obviously, these two mindsets are not going to work out well. You're looking for two different things. You're ready to interview a prospective associate. Understand that they are interviewing you too. And someone once gave me the advice to interview someone as if they would be your employer. So ask yourself if this is someone you would like to work for. After the interview, if you're interested in the candidate, express it. Offer a working interview. This should be considered just an extension of the interview process, something you always want to do. Let the candidate spend time with your staff and patients. Evaluate their skills and personal interactions. Don't have them come in to do dentistry without evaluating them. I've actually had candidates come to a working interview and the practice owner isn't there to observe. This can be a good way to tell both of you whether this is a good fit for your practice. Most associate employer issues can be resolved with discussion and compromise, but conflicting philosophies can destroy a good working relationship. To avoid personality conflicts, you may want to use the personality test. Get your staff involved in the hiring process. You know they can make the difference in the well-being of your practice. They know your personality and probably can determine if you are compatible with the candidate, perhaps better than you. Invite the prospective associate to meet with you and your spouse or significant other. They may be able to determine if this is a good personality match for you. So you're ready to make an offer. You want to agree on everything verbally, but put everything in writing. It's beneficial for both of you. It's going to eliminate many disputes. And then prepare an employment agreement. The employer should fulfill any verbal promises made to the associate in the written agreement. You know the dental business is different than other types of businesses, so try to find an attorney that can help you. Ask an attorney to review the employment agreement and any practice purchase sales agreement. If you offer a position to an associate, send them a contract to review in a timely manner and agree on a deadline for a time to accept. Unfortunately, we hear of opportunities where practice owners hand a contract to an associate after an interview, and they just leave it. There's no follow-up plan. There's no timeline put on it, and it's really important to make sure that you're going to follow up on that in a timely manner. You need to communicate after you've hired the associate as well, so it doesn't stop at the interview. Recognize that all relationships have their ups and downs, as we all know, so have regularly scheduled meetings with your associates. Don't wait until there's a problem to communicate with them. At that point, it could be too late, and oftentimes it is. There's a good reason to mentor your new associate. It may pay off in the end. Some associates are looking for a mentor who will help them improve their practice, management, and clinical skills. These new dentists are excited about the benefits that working with a senior dentist offers. For some senior dentists, the ability to mentor a new dentist is exciting. Many owners I've worked with really enjoy helping a young dentist begin his or her career. This is where you can really help. Teach them your business, especially if you want to partner or to transition your practice. That will only help you. Understanding the various components necessary to operate the business side of a dental practice is the best indicator of future success as a partner. Now, I would like to turn the presentation over to Heather Brown. She will share some tips with you about a potential partnership or ownership for the new associate. Heather?
Thank you, Cindy. Hello, everyone. Thank you so much for joining us today. I will be talking about tips to prepare for a successful partnership or transition. Some of the points that we're going to cover today are going to be the purchase price, written agreements, and skill sets and philosophies. The first point I wanted to cover was the purchase price. You always want to set the purchase price prior to employment. If the purchase price is agreed to before employment starts, 75% of buy-ins or buyouts occur as planned. If the purchase price is not agreed to before employment, only 10% of buy-ins or buyouts occur as they were planned. So that's very important. The second thing I wanted to cover was the written agreements. Cindy has already gone over the employment agreement, the detail and the terms of the employment, but we both cannot stress enough to get everything in writing. This is one of the most important steps in associateships, partnerships, and transitions. Many doctors feel comfortable enough with their new associates or their new employers that they feel that they can verbally agree on terms without putting them in the writing. This typically never ends well, can cause major financial damage to a practice. Also, the use of attorneys and CPAs are always recommended as advisors. However, it may be wise to have templates for both employment agreements and letter of intents to be drawn up ahead of time. In this case, minimal changes will need to be made to the templates once an associate or buyer is located. Sometimes these professionals go from advisors to negotiators, which ends up damaging or even ending the relationship with the new doctor before it starts. As I said, Cindy already discussed the employment agreement details, so I will go over some of the letter of intent details needed. While the letter of intent is not binding, it does represent the expected details of the partnership or transition. The first thing that it should include is a proposed date of sale. When will this partnership or transition take place? The second thing it needs to cover is the proposed sales price. This must be, again, agreed upon before moving forward with any ownership transaction, as we previously discussed. The exit plan. This needs to be addressed in writing prior to any association. If the owner decides they do not want to continue this relationship, how is it going to end? If the associate or buyer decides they don't want to continue this relationship, how is it going to end? How will payments be made to the current partner if the relationship fails? Will there be a penalty imposed on either party if one walks away? The fourth point is real estate purchase options. If the real estate is involved, will the new partner or owner be expected to purchase or lease the real estate? What will the purchase price or the rent be? And the final point on that is patient distribution and income share. How will the current patients be distributed? How will the new patients be handled? How will the income be divided and bills be shared? The last and final point I wanted to talk about was the skill sets and philosophies. A partnership or a transition can be like a marriage. To maintain a good marriage, ideals, ethics, morals, etc., must match. Also, personalities must be compatible. One of the most important evaluations that must be made pertains to skill set. Does the new doctor's skill set match or at least compare with the owner's or vice versa? If one doctor is below standard, it can affect not only the relationship between the doctors, but also the patient base. A working interview or a trial period before beginning negotiations can alleviate a lot of future potential issues. The philosophy of business is another match that must be made. The sharing of practice information such as tax returns, income, and profit and loss statements is vital to a business relationship. If an owner is not willing to share this information with a potential buyer or partner, it raises a lot of red flags and typically ends the transaction before it even begins. Another thing that needs to be considered by the owner is their willingness to transition. This involves setting goals after the transition that includes the owner's hobbies or interests outside of their business. As an owner with more free time, what do you plan to do with that time? Golf, fish, travel? Sometimes these transactions fail because the owner does not have another life planned after practice. They have a hard time letting go and walking away because they do not have an exit strategy. Determine what interests you and make plans to tackle those interests head on. Also, consider your budget and what will it take to maintain your new lifestyle. This can make the difference between deciding to do this now or maybe 3 to 5 years from now.
Our clients come to us because they want the right and best associate. We're a national organization. We place thousands of positions, or we place thousands of candidates, associates every year, or thousands over the years. We've been very successful. Our searches are strictly confidential for you, so we respect your confidentiality. We have available candidates, and we conduct custom searches. That's what HSNDO can do. Well, of course, we're backed by Henry Schein. We're part of Henry Schein, which is a global organization, a Fortune 500 company, the largest dental distributor in the U.S., named one of the 2020 world's most ethical companies by Ethisphere, the 9th consecutive year. And this is the contact information for myself and for Heather. It's listed here. So if you need our service or if you have any questions of either of us, we would be happy to talk with you at any time. I thank you for your time and we wish you well.
Thank you, Cindy and Heather, for your time today. As a thank you for attending, everyone will receive the recording of this webinar via email sometime in the next week. For more Henry Schein webinars, visit henryscheindental.com/webinars for our upcoming schedule. Thank you all for joining us, and we look forward to seeing you back here soon.